It's a very difficult disease to treat. I work in the emergency department as a physician. A lot of the critical care physicians are working 24 hours and more, just incredibly long hours. And people, when they aren't here, are also working on communicating and discussing what the best ways to take care of the patients who have this illness are. At the beginning, we saw a lot of people who were having flu-like symptoms. Pretty quickly from there, we saw people who were starting to deteriorate rapidly, and they were going from basically just having a flu-like illness to needing oxygen, to needing a ventilator, and in a lot of cases dying. The biggest thing is to avoid getting the disease and to avoid passing it along. And the two things that I would say are, one, I think all the social distancing stuff is really, really important. And the other is, I think that a lot of people might have gotten the impression that this is really a disease for old people. And that's just not our experience at all. We have lots of young people who are very sick and in a lot of cases dying from the disease despite incredible resuscitative efforts.
COVID-19 is overwhelming our hospital systems. Governor Cuomo said it best. It doesn't just start a fire and stop when you put that fire out. It consumes another place and consumes another place. So it just keeps spreading until we flatten that curve.
Social distancing, how are you?
Virtual hug. Virtual hug.
I'm LORRAINE CASHIN. I am the program director of the graduate program in physician assistant studies at Mercy College. It is a global crisis, and the physician assistants, many of our graduates are on the front line. They're doing extraordinary work. My first job was in the emergency room at Elmhurst Hospital. Elmhurst Hospital Center is a constantly busy emergency department, and right now it is really considered ground zero of the epicenter.
This is the front lines for sure. This is where the largest percentage of coronavirus patients, at least in the United States right now, is.
They're running out of personal protective equipment. They are pleading for all different types of equipment. So our medical director, Dr. David CHERKAS, medical director here for Mercy College, also works on the front lines as one of the emergency room doctors at Elmhurst, and he has worked probably at this point in time 16 shifts in a row.
The Bronx community around Mercy College and the community here in Queens have a lot in common. A lot of hardworking immigrants, blue collar, people who often don't have enough access to health care in general. And so when something like this happens, the already stretched system that they're counting on just can't flex anymore.
We're bringing all of the equipment that we have here at Mercy College on the Bronx campus. We're bringing everything we have, our masks, our gowns, our gloves. We're going to drive from the Bronx, which is where we are right now. We've picked up the equipment, we've loaded our cars. We're going to drive down to Elmhurst Hospital, and we're going to meet Dr. CHERKAS in the ambulance bay before he goes into the hospital.
David.
Oh, you're here, Doc. Good. Good. Excellent. What we're going to do is we'll load everything on the stretcher for you. You're going to get it in?
That's great. I have a pretty good draft guideline on how to care for adults. I'll send it to you. One of the major issues is personal protective equipment for the staff. These are in pretty short supply. Gowns, gloves, also in short supply. And so in order to keep the staff safe while we're caring for these patients, we've been fortunate enough to get incredible donations, in this case from Mercy College. I'm going to get to work.
We love the Bronx, and I know that we're Bronx strong. This is global, national, and as a Mercy community, we continue to put ourselves on the front line and continue to do whatever we can to try to help flatten this curve.